So I was going to touch on the aspect of sleep and dentistry, and not sleep dentistry, but sleep and dentistry. And I think one thing that we shouldn't forget, and I'm putting this in just as a little aside, but one thing perhaps we shouldn't forget is that two of the things that impact sleep a lot are pain and anxiety. And although many times it's upper limb, hip, that sort of things, pain that will obviously present a problem for the sleeper because they can't lay on one side or the other, or when they do it wakes them up because it's painful. But we are involved in dentistry not only in acute but very frequently in chronic pain. And I'm not just thinking about TMD, I'm thinking about generalized facial pain, but nonetheless, outside of trigeminal neuralgia and things like that, then TMD has got a large part to play. And of course, anxiety is coupled in with not just going to the dentist, but also to, for instance, obstructive sleep apnea and sleep disordered breathing. That is a known association. I was going to say complication, probably complication, but I'll just say association to stay safe. So as dentists, not only do we screen people much more easily than a doctor would, although truthfully without getting into trouble, it always was a question that was asked when I was a kid, and the doctors would always ask, how were your bowel movements and how was your sleep? And I know they're not exactly the same, but now we're so rushed and we have to focus down, and we're in a big hurry to get things, have tests done and special tests. So medically speaking, although that should still be, I believe, an important part of it, we can follow up because we see patients on a regular basis. We see them when they're not always overtly ill. In fact, they're usually overtly well when they come to see us on a regular basis. And we have, and I keep going back to this, but we have the facility with a team to be able to screen our patients far more easily perhaps than any other healthcare provider. And I see, might be a bit controversial, but I'm going to stick my neck out and say this. I've been in dentistry long enough to see things come up in dentistry and dentists poo-poo them and not be very interested either because they're not sexy things or because they're not particularly profitable at that point. And someone will take over, and a particular group or other profession will say, if they're not interested, I'll treat it. And one was complete dentures, and one was non-surgical periodontal treatment. And in fact, one was implants for a short time, but then people realised actually they're very profitable, and so instantly got taken back again. And TMD is the next one now. We see that going to physiotherapists, chiropractors, and the like. And it's kind of sad in a way. It's a sad reflection of the dental profession that something so I don't like using the word pivotal because it sounds like a play on words, but I'm going to say pivotal. Something so pivotal to us would just get forgotten about and picked up by someone else. So what's the next one? Sleep. It's in our laps. It's in front of us. The airway is in front of us. So are we just going to wait until we lose that too? Possibly. So it's up to us to do something about it. We can make a tremendous difference, but only if we're doing it. Okay, thanks.